So this initiative, which the Amazon Web Services collaborates with ECPAF, the Elizabeth Glaser Pediatric AIDS Foundation. Amazon has one of its objectives really in terms of using some of the cloud technologies to improve healthcare, the quality of healthcare. And ECPAF, its mission primarily is really for eradication of pediatric HIV, for AIDS-free generation. Would like to use technologies to improve quality of care, and this is a perfect opportunity where the tech companies and implementing partners come together to do that. So that's what we are working, and we're working on developing a number of AI models, generative models, predictive models that we are currently working on. And ECPAF is a recipient of the first, actually the 3 grants from Amazon Web Services.
Interesting. You seem to be doing a lot of work in Malawi. Your generative AIs are already working out there. How can this help people, especially people who are fighting these HIV/AIDS, the people who work in that space? How can generative AI help them to do their jobs better?
So basically, what generative AI does is that it really helps the healthcare workers in guiding them in making a better clinical decision making, because it provides, for example, for interpreting the diagnostics, the imaging, for example, so it quickly can read X-rays, CT scans, MRIs, and so forth. So it's really used for screening, and especially for children. Now this is being worked on. WHO is working on. Particularly for adults, this is already a validated technology. It really helps to propose a personalized and customized support, a treatment plan for kids and mothers. And it also really helps by making the services really available, accessible, 24/7. Now, all these virtual systems, AI-powered telemedicine now really helps. So 24/7 mothers and children have, they can, for their emergencies, for others, AI tools are now, taking over. So this is really it's revolutionizing actually healthcare for patients. Appointment and medical management. So this. Yeah.
How about in situations where most of the hospitals, most of the people who deal with patients come from rural areas, people
Yes.
who are dealing with HIV are usually not privileged to have a lot of information. How does generative AI, or how do you plan to use this in terms of collecting data for some of these patients?
So for collection of data, most of now our patients, most of our population in Africa now, I mean, smartphones are very much well used, so they're there, in any rural part, we do have the smartphones, and so AI-powered, apps are in the smartphones, and then the patients get, messages, appointment reminders, and they can also communicate with those, with the clinicians, and so and those are linked to the medical record system. So that way, patients know what their conditions, they can communicate, they have their health records, and those data, again, can be also captured through the various systems in which we can use.
So you're leveraging on existing technology, but bringing in these new tools, and you've had success in Malawi. Can this be replicated in other places?
Oh, definitely. Oh, definitely. What has been done in Malawi, Malawi is one of the, resource limited countries, and so the national patient level electronic medical record and health information ecosystem that has been built in Malawi, there is no reason that cannot be built in other African countries, provided that there is a political will and there is a political commitment and the donor commitment, and have the right implementing partners in place. This definitely can be done. Something done in Malawi, surely it can be done in other sub-Saharan African countries.